Hi, my name is Reem and I'm a fourth year peer mentor in the general lab, and today we're going to go over the PPE OSCE. So with PPE, it's super important to understand what each precaution and isolation precaution requires. So we have our droplet contact precautions. So we would have to wear a mask, eyewear, gloves, and gown. Contact precaution, just glove and gowns. An airborne precaution, an N95 would be required. There's also droplet precaution, which would require a mask and eyewear, or as you saw with droplet contact, there could be a combination of multiple. For today's example, we're going to do droplet contact to go over the process of all the PPE, so you know how to do it in the worst case scenario. If you just had contact, you wouldn't be required to do the steps that aren't listed on the isolation precaution sheet. These sheets are found outside patient's room, usually hung up above the doorway. So I'm going to start off by doing my hand hygiene. I could either wash my hands or just do a hand rub. For the purposes of today, I'm just going to be using hand sanitizer. So I'm going to make sure I rub my hands for at least 15 seconds and that the gel completely dries. Next, I'm going to grab my gown. This one is already pre-tied at the back, so I don't have to worry about that. I'm going to put my arms through. And one tip that I always give students is to put your thumb in the sleeve of the gown. That way later on when you're doffing and you're taking off your gloves, it's easier to remove the gown without having to touch it. Then I'm going to make sure that I'm tying it in the back. I want to make sure that I am tying it securely, but not tight enough that I'm going to struggle afterwards to remove it. If your gown doesn't come tied at the top, you want to make sure that you also tie it there as well. I'm going to move on and put on my mask, making sure that I'm grabbing it by the loops. And then I'm going to secure it around my nose and pull it under my chin. I personally like to breathe out a couple times to make sure that I have a proper seal. Because I wear glasses, if my glasses fog up, then I know I have to readjust my seal. Then I'm going to put on my eye protection. If your glasses do not come with side covers, you have to make sure that you're wearing additional goggles to protect yourself. An eye shield would also work in this scenario if your agency policy allows for that. So I'm making sure that I'm covered on the sides and that it's secure here. Perfect. Then I'm going to put on my gloves. With my gloves, I'm making sure that they're going over my gown. That way I am completely covered. And now I'm ready to enter the patient's room. We always want to make sure that we provide privacy for the patient, whether that is closing the curtain or closing the door. Now, because I touched the curtain, I've essentially broken my hand hygiene. So if I'm not wearing gloves, I want to make sure that I reapply my hand sanitizer if I'm going to touch the patient or anything inside of the room. Good morning. My name is Reem Boudali. I'm a fourth year nursing student at the University of Windsor. I go by she, her pronouns, and I'm here just to check up on you. How are you doing?
I'm doing well.
Can I ask for your first and last name? Can you show me your wristband while you do that?
Yep, Alex Smith.
Perfect. Can you tell me your date of birth?
January 23rd, 1966.
Perfect. And what pronouns do you use?
She, her pronouns.
Wonderful. So in case you're wondering why I'm wearing PPE, the PPE helps protect both me and yourself. It protects me in case any of the patients have any microorganisms that can pass on, and it also helps protect you so that I don't pass on anything from either myself or from other patients. Do you have any questions about that?
No,
Is there anything I can help you with at this moment?
not right now. Thank you.
Okay, I'm just gonna leave your call bell with you. Just make sure that you click it if you ever need any assistance, and the alarm outside will ring so that someone can come and help you. Okay?
All right, thanks.
Take care. So now I'm going to remove my PPE. I'm going to start off with my gloves. So I want to make sure that I'm grabbing the outside of it with my other gloved hand. And while I'm doing that, I'm also going to grab that part of my gown so that my gown also comes off, but my hand is still on the inside where it's safe. Now that I have this glove, I'm going to either use the outside of my gown or I can use my hand. And if I use my hand, I'm going to grab the inside. If I use my gown, I can touch the outside because it's still dirty. Just like that. It's in the palm of my hand and I'm going to throw that out. Perfect. Then I'm going to remove my gown. So I can untie from the back. And then I'm going to let it fall off of my shoulders. And I'm going to bend over and just sort of shrug it as it comes off. And I'm going to roll it into itself. So this is the outside portion that was in contact with the patient, and I'm going to roll it into itself. That way the clean part that was touching me, I can grab. And then I'm just going to roll it and toss it into the garbage. At this point, I'm going to do my hand hygiene. So again, 15 seconds. Then I'm going to remove my eyewear. I want to make sure that I'm not touching the outside of it. Again, that was in contact with the patient's environment. And then I can remove my mask. Make sure that you remove it from the loops. Away from me, you don't want to touch the inside, and toss it. Then I want to perform hand hygiene again for 15 seconds. So if I had airborne precautions, or if I had airborne with contact and droplet, I want to make sure that I'm putting on an N95. You want to make sure that your N95 is mask fitted to you, so you have to go to an agency and get a mask fit card so that you have the right size. This is an 1860S, which is mask fitted for me. So I'm going to take my mask, I'm going to put it in the palm of my hand, I'm going to put it over my mouth, and then I'm going to start with the top loop. I'm going to take it over, and then I'm going to take the bottom and take that over as well. Then what I'm going to do is I'm going to take my fingers and I'm going to work along the string to make sure that it isn't churned on itself and that it's straight all the way throughout. Perfect. Then I'm going to make sure that I'm securing it around my nose. And then I'm going to take my hands first at the bottom and I'm going to huff and I'm going to puff and I'm going to see if I can feel that air coming out from the bottom. Nothing, and then I'm going to do that over the top. Perfect. If for whatever reason I feel air at the bottom, that means it's not securely fit to my face, and I'm going to readjust and keep on trying until I don't feel any air. It's super important since a lot of the airborne precautions are high risk situations and you don't want to cause harm to yourself. When you're removing, you always want to remove with the bottom loop, because if I were to remove from the top loop, then the mask would flip down and it could potentially touch me, and we don't want that outside of the mask to touch ourselves. So bottom loop is off. Then I'm going to take my front loop, and again, away from me, I would toss that into the trash.